Cool. So I'll just give an opener. I understand the Police Commissioner is coming out as well, or he's out at 8:45, so he'll be able to talk about the border control measures. I'll just talk about Parliament and the health and any other questions, but I'm not sure if he's here or have you guys been alerted? I just came out of a briefing with him and he said he's doing... Anyway.
Is that the Police Commissioner?
Yeah.
Yesterday, maybe they'll do it in a room in Parliament or outside or something. Because I just said to them, you'll do it in a little pokey room somewhere.
That's right.
They're looking for a bigger space. So maybe they'll do it in Litchfield or something.
Jane, can we use your paper?
Yeah, you can use...
Thanks, Greg. Sorry.
Everybody good? With the paper, I mean.
Thanks, James.
Good to go? Natasha Files, Leader of Government Business. The Northern Territory Parliament today resumes. We do have 3 days of parliamentary sittings planned, but we will, of course, listen to the advice of clinical professionals. The Chief Minister will be in National Cabinet this evening. So this morning we have 2 bills on urgency. One is in relation to the Public and Environmental Health Act. We have, in the course of this public health event, realised that some of our legislation has been very much designed around natural disasters and a 5-day period of time. This essentially extends the declaration under the Public and Environmental Health Act to go for up to 90 days. It also has information sharing provisions that you see in the Emergency Management Act to make sure that those on the front line can protect Territorians and are working together. You'll also see the Treasurer introduce a supply bill. This is to ensure supply past July 1st. We saw the federal government, in an unprecedented move last week, announce that there will be no federal budget in May of this year, that their budget will be pushed back to October, and all states and territories will follow suit. So those are the 2 bills that will be introduced on urgency. That means that they will be debated and passed today here in the Northern Territory Parliament. We also have a number of other pieces of legislation, and I have advised the opposition and independents of those bills, but we will see how we manage our time and also where we end up in terms of decisions, further decisions coming out of National Cabinet. I also want to update Territorians this morning that we do have 1 more confirmed coronavirus case. I have been advised by the Centre for Disease Control that this is a 75-year-old male who recently returned from overseas. Further details will be provided, but contact tracing, I should say, is now underway. The individual did arrive into the top end, I understand, and has remained in isolation. So this is not community transmission, and the community is at very low risk. But we remind Territorians, please, if you are feeling unwell or if you meet the criteria, you must isolate. I'd be happy to take any questions.
What real powers do the new...
75.
What real powers do the new measures give? I mean, is that to enforce people to quarantine and enforce people to do the border restrictions? What powers will that give?
So it is the current powers that the Chief Health Officer has, but they were in place for 5 days. So I signed that declaration last week, and that was for 5 days. So rather than going back and signing that every 5 days, which previously they had been built around a natural disaster type emergency, a cyclone, it will extend them to up to 90 days. So that means every 90 days they would need to be reissued. So it's to provide clarity and confidence.
Know what they actually are? You know, can you give us a few real-world examples of what those powers are?
So these are the public health, this is to give the Chief Health Officer the ability to isolate people that aren't complying with what they should be. And as I said yesterday, that is 400 penalty units, which is up to a $60,000 $1,000 fine. There are serious measures in place, but we know the community care about each other and they are self-isolating, and that fine would be at the end, as you would know, of a court process. But this is to give our Chief Health Officer the powers to protect Territorians.
Is that you could bring someone into isolation as well, or force someone to come into hospital or something if they were saying, no, I just want to stay at home and things like that?
Potentially, but as we've seen, particularly with Queensland, where they did in the initial phases of their self-isolation follow and track people, we saw a very high rate of compliance. People understand that for us to tackle the coronavirus, we need to look out for each other, and people must isolate if they meet the criteria as outlined by health officials or if they're feeling unwell. I don't have the details of where he's come in from. I was advised literally in the last hour that testing had come back positive last night. My understanding is there's been very minimal contact. He had done the absolute right thing and self-isolated at home. He will attend a hospital today to make sure that he gets the clinical care, and then it'll be decided whether he stays at Royal Darwin Hospital or goes out to that Howard Springs facility that we stood up yesterday.
The laws with the information sharing, is that so like police and health all can access the same files and know who's infected, who should be isolating? Can they use that to track phones as well?
So it's the information sharing powers that you currently have under the Emergency Management Act. The acts were always designed to go from one to the other, and so in dealing with this public health emergency, we need those powers within the Public Health and Environmental Health Act.
But just so people know what they are, just give us one example.
In terms of using people's phones, I don't have those details. I'd be happy to provide that. This is about giving health professionals the resources they need in terms of sharing information to protect the Northern Territory community. So what we have clearly seen through this public health emergency is that the legislation currently in place in the Northern Territory was very much designed around a natural disaster, a flood for a few days, a hailstorm event, for example, in Central Australia, or a cyclone in the top end. What we have realised is that we need to extend those powers for a reasonable time period. That is why it's for up to 90 days. So if we did go back in the future to a natural disaster event, signing it off, you could put that shorter time frame, or you can, in this situation, put it in for that quite lengthy time frame. And then it is the information sharing that you currently see under the Emergency Management Act. It's so the Chief Health Officer has the ability to share information so that we can protect the community. As I understand, the Territory Alliance have said that they are the opposition. I have been, as you can imagine, busy this morning, and I haven't seen the seating in the chamber, so that would be a question for the Speaker of the Assembly. Has she moved the seating around? So in terms of who we recognise, it is the person sitting opposite the Chief Minister. I make an assumption that that will be Territory Alliance, but all will be revealed in a couple of hours' time. I'm not aware of that. That would be an operational question for the Police Commissioner. So our legislation here in the Northern Territory outlines that we have a fixed 4-year term, and we have that in legislation that our election will be held on August 22nd. I don't think anyone can predict what will be happening. We can't even predict what will be happening in the next few weeks, but it's certainly our intention that election would be held, and there would be mechanisms perhaps that the Electoral Commissioner could use if we weren't able to have a face-to-face election, but I think that's for something for down the track. And that is certainly one of the questions that's been raised, but that is August 22nd. We are currently just a couple of days past March 22nd. A lot will happen between now and then. We need Territorians to understand that we're putting in place measures to protect them. We are working as hard as we can across government. I have just come out of emergency cabinet around making sure that we're doing everything we can to support those Territory businesses that we know are going through very tough times right now and will have more tough days ahead of them.
This is probably the only time you might be able to sit in the next few months. Shouldn't you change the electoral cycle on urgency to protect the public, and so the public has some confidence that someone is actually going to be leading the coronavirus effort, past, basically August, because it's unlikely it's going to be over in 4 months or 5 months, really?
There are a lot of assumptions in that question. As I said, there's many weeks ahead of us, many tough weeks, and the Chief Minister has made sure that Territory businesses, Territory families are at the forefront in every decision that we're making. In terms of the question from Sky around education, we have said that education education is compulsory from the beginning of term 2, but for the next couple of weeks, parents are best placed to make the decision around their child's education. My children are at school today because I know that's the best place for them, but there are other families that have various situations. Is there somebody in the family that has an underlying illness? And from term 2, there will be resources in place, whether children learn online or face-to-face in the classroom. But there will be many tough decisions that Territorians have to make over the next few weeks, and those decisions we're making as a government are listening to the health professionals, and the Chief Minister will make sure that the Territory's views are heard at that National Cabinet tonight.
Does there need to be more testing in the NT just to make sure that there hasn't been community transmission? How much testing is being done?
So we have been doing significant numbers of tests. I don't have the specifics, but they're in the hundreds. I would estimate over 1,000 at this point. In terms of testing, I had a teleconference meeting with all the state and territory and the federal health minister yesterday, and they did talk about the advancements in testing and technology, equipment that can turn those tests around quicker. Of course, we need to make sure that it has been thoroughly assessed, but we're certainly trying to put as many testing resources in the territory as possible so that we can turn those results around quickly, because we are coming into the flu and cold season, and we don't want people, we want people to know, have they got COVID-19 or is it another type of illness?
So is there potential that there are quite a few people out there who could potentially have COVID-19 but we just don't know because the testing rate
We have a strong testing regime, and anyone that is feeling ill is advised to call the public health hotline, and then clinically they will be assessed, and it will be decided from a clinical perspective whether they need a test. What I'm talking about is additional resources that we can bring into the Territory and Australia, and this is something that's been looked at around the world to provide quick information to patients.
Diabetic and showing symptoms after coming into contact with a colleague who recently returned from overseas before the isolation order and now is showing symptoms but hasn't been tested. I mean, what do you say to people who are confused or concerned about that rate of testing not covering things like that?
There are strong protocols in place, so people need to reach out to their GP or the public health unit. They will then be assessed, and of course, if someone has an underlying condition, that will be taken into account. I can assure you our health professionals are working around the clock. This morning when I spoke to the Centre for Disease Control, people had been there all night. So Territorians need to understand that this is an unprecedented health emergency that we are facing, but we are putting every resource in place so that we can turn test results around as quick as possible, so that we've got the facilities to care for people, to isolate people, and we're doing everything we can to support Territorians.
Are you going to get Auslan interpreters for the health messages so that people who are hearing impaired will be able to get these messages as well, like different bushfires, cyclones, etc.?
So very early on, I inquired about the ability to have Auslan interpreters. I recently had a meeting and I had to use a telepresence Auslan interpreter from overseas, and certainly about sharing information with everyone in our community is important, but my understanding is there's no availability, but we're certainly trying to make sure that we do provide that information to all Territorians and that they can understand that.
Can you explain how the situation will work
That would be best left. The Chief Commissioner will be briefing the media and he will be able to walk through those operational details. I was just briefed on them, and the police have a number of measures that they'll be putting in place. Signage is going up in those nearby bordering towns and locations to advise people of the new measures, and he'll provide more detail. Kathleen? That's been a very important point of discussion, and I understand that the Treasurer will be providing figures on a regular basis to inform the community. But it is very difficult. The federal budget, as I said, has been deferred to October. We won't be able to hand down our budget, but we will certainly make sure that Territorians will see where that expenditure is going, that they know it's being spent in those essential services of health, police, and also supporting Territory businesses.
The supply bill that you're doing is will obviously keep services going, but can you give a guarantee we won't see any new grants for discretionary projects and things that we haven't heard about yet. They won't be slipped into that as well, will they?
I can assure Territorians right now, we know that our budget is focused on the health response, the emergency services response, and also helping Territory businesses. I don't think even a week or so ago anyone could have imagined what we saw yesterday, and there will be more pain for Territorians coming. But everything we are doing is to support them from a health perspective and then to recover and rebuild the Northern Territory.
What message or advice do you have for people who are now self-isolating after flying in on any of the domestic or international flights that have had a positive test, who haven't been contacted by the CDC, are struggling to get that information on the hotlines, but are fearful they've put their family in danger?
In terms of the CDC, they are contacting the close contacts on those planes, so I understand that's 2 rows around them, and people that have flown in from international and also domestically as of this afternoon also needs to self-isolate. But there's a clear message for Territorians. If you start to feel unwell, make sure that you practice those hygiene messages, that you try and I know it's difficult, especially in a family situation, that you try and avoid those personal hygiene measures in place to protect you and your family around you. The majority of people that get the coronavirus, around 80%, will just have a moderate to mild illness. But it's about protecting the most vulnerable in our community and stopping that community transmission.
Is 2 rows enough? Because people move around on planes, they get up and go to the toilet, and we've already heard that this virus is far more easily transmitted than, say, the flu. Shouldn't everyone on a plane like that be tested?
That's a clinical decision that is made, and they certainly challenge all of those thoughts. But it is a clinical decision around close contact, and that would be the advice. Thank you. Yes, we said it yesterday on your radio show.
In Darwin, what about Alice?
Alice has got it around. And then we've got the ability to stand up more and more, so there's